Buongiorno, siamo collegati con la professoressa Lisa Iannacci-Manasia, professoressa alla Scuola di Nursing della Columbia University di New York, nonché visiting professor presso il corso di laurea in infermieristica pediatrica dell'Università degli Studi di Torino. La professoressa Iannacci-Manasia è il tutor responsabile dello scambio di mobilità internazionale fra le due università ed è il tutor degli studenti statunitensi e torinesi che aderiscono allo scambio. Prego, professoressa.
Thank you. It is my pleasure and honor to be here this morning with you all at the University of Turin. And it's important to say that I speak on behalf of Columbia University School of Nursing and our renowned faculty and leadership. This exchange program happens through our global initiatives and global research division. Our school is led by our wonderful deans, Dr. Lorraine Frazier, Dean of the School of Nursing, and our Vice Dean, Dr. Judy Honig. The Office of Global Initiatives and Global Research is directed by Dr. Jennifer Dorn, nurse midwife and Associate Professor of Nursing, who has single-handedly spearheaded and led this very unique program of ours, where students are able to with our partners, are able to exchange experiences at 14 global clinical sites throughout the world. Furthermore, the program actually happens within the structure of our Master's Direct Entry program, which is the entry level at Columbia University School of Nursing to become a nurse. And this program, the Master's Direct Entry program, was formally directed by Dr. Karen Desjardins when we began this exchange with the University of Turin, and is currently directed by Dr. Heidi Hahn-Schroeder, excuse me. So it is with great pleasure and honor that I speak on behalf of all of us about this incredible and robust exchange with the University of Turin. I am going to be talking with you about specific questions that have been presented by the student and faculty body at the University of Turin. Thank you. The value of the global exchange is really related to the concepts of cultural diversity and the social determinants of health. Both represent threads that we emphasize and that are woven throughout our curriculum. The pedagogic methods we utilize are really predicated on the idea that students need to learn how to think critically. They need to know how and where to find knowledge so as to engage in a lifetime of evidence-based practice. And in doing so, they need to know how to learn from each other, peer-to-peer. They need to know how to learn from other disciplines and other professionals. This, we believe, succeeds in forming and educating nurses who are adaptable and can practice in any setting. Getting students comfortable in different cultures teaches them about the social determinants of health at the very granular level. They learn how various factors that can affect an individual's health operate and how that can change from one population to another. Furthermore, given the interpersonal aspect of being a nurse, intercultural skill building is essential to effectively care for patients. Knowing how to do this, knowing how to adapt in another culture and develop these skills is critical to forming future nurses and leaders who are capable of contributing to the health challenges facing individuals and populations. And we saw this firsthand in the way nurses responded across the world globally to the COVID crisis. In our own reality, nurses had to step up to the plate and suddenly become ICU nurses when they were not that previous to COVID. And likewise, nurses traveled across the country to fill in gaps as the need arose from one state to the next. Well, the personal and professional benefits are many, but to answer this question, I'm going to use the experience of one young man because I believe his experience was really exemplary for many of the students. So first of all, it's important to mention that our students do not need any proficiency in Italian to participate in the global exchange with the University of Turin, which is really wonderful. And this teaches in a way that is particularly remarkable. So James was assigned to a pediatric oncology unit for his 6 weeks at Regina Margherita. Didn't know a word of Italian. And he describes how he had to learn how to provide care despite the language barrier. So we talk all the time about meaningful presence in nursing and the importance of what you transmit in your body language. Well, James learned that firsthand. He had to learn how to effectively provide competent care and at the same time communicate passion and caring when he did not speak one word of the Italian language. So in that, professionally, students learn about the many dimensions of communication. Personally, I believe that students learn about reverence for life or the fragility of life and its sometimes elusive nature. James describes about how 1 minute, an adolescent he was taking care of was training for the marathon, and the next minute, with a diagnosis of child cancer, his life changed dramatically. So from that, personally, James grew, first of all, as he reflected on his own mortality and limitations. And secondly, I believe that he described what can be regarded as the privilege and honor of being part of someone's story, whether you're caring for them as a nurse or you've established a relationship as a human being. And that is a remarkable personal growth. So with respects to students' ability to enhance their clinical reasoning vis-a-vis these global experiences, I'm going to describe the experience that the University of Turin nursing students had when they came to Columbia University last summer and spent 4 weeks rotating through the Children's Hospital at Columbia University Medical Center. They described the universality of patient scenarios. So for example, one young nurse talked about how pain in a child in the United States is the exact same scenario of pain in a child in Italy. However, she identified that the context is very different and needs to be added to the equation when you're contemplating how to intervene or how to care for patients. And I think I can best add to this by saying that when you're in a different healthcare system and dealing with a different population, you need to consider the cultural implications, you need to consider the family dynamic, and you need to consider the healthcare system environment. So in the United States, students learn our reality. And in advanced practice, our reality is that advanced practice nurses have prescriptive privileges. So your approach will be determined by that. In Italy, however, nurses do not have prescriptive privileges on any level. However, the public can actually avail themselves to medications and pharmaceutical products that here in the United States they need a prescription for, but in Italy they can get easily from the pharmacy. In addition, there's more of an emphasis in Italy on things like complementary alternative medicine. So when contemplating your clinical approach to caring for a patient who's experiencing pain in Italy, while you cannot necessarily prescribe medications that are indicated, you can contemplate alternative medicine more thoroughly. Whereas in the United States, nurses would, advanced practice nurses would be able to prescribe. So your clinical reasoning is really sharpened by understanding that context is an important part of the equation. And this adds tremendous dimension to making your clinical reasoning much more comprehensive. It also enables graduates to pursue careers overseas in any setting. Well, first and foremost, the most remarkable thing about the Italian healthcare system is that everyone has access to care. And the other quality that I appreciate is that there is tremendous emphasis on primary care and prevention, whereas we're more oriented at the other end of the spectrum. Your Italian healthcare system ensures that everyone receives care, particularly infants and children, at whatever level they need. This is especially evidenced by the fact that your prenatal care is offered and given to everyone, ensuring a healthy beginning or the healthiest beginning possible to life. And this has tremendous impact in terms of one's trajectory into adulthood and health issues that can be incurred from the history of not having good prenatal care. And this is reflected in your infant mortality rates, which, by the way, are relatively low compared to other industrialized nations and reflect very positively on the healthcare services that you provide. In addition, your emphasis on population health and prevention enabled you to successfully deal with COVID and emerge in an excellent state. It was really remarkable to us to watch you all through that. And so I also appreciate the politics behind the way resources are allocated in your Italian healthcare system. While the central Italian government works and operates centrally, it works with regional counterparts to determine appropriate allocation of resources. This ensures a uniform standard of care throughout Italy, but at the same time allows for local autonomy and for regions to allocate funds and resources the way they see fit to render both primary, specialist, and emergency care at all the levels, depending upon their own reality or the needs in that particular region. So it's ideal in this sense in that there is a centralized body or standard, but flexibility and autonomy that is afforded the regions. So in talking about my experience with clinical practice in Italy, we must first remember that it was more than 30 years ago. And having come out of Columbia University School of Nursing bachelor's program as a new nurse, I embraced a role that was very much one of being an independent thinker. And in fact, I had come to Italy having had that educational background and having had 4.5 years experience as a clinical nurse specialist in pediatric oncology. So when I arrived on the doorsteps of Turin, I had that as a background, and what struck me the most as I was working with nurses in your pediatric oncology division was that Italian nurses had to adopt the most advanced aspects of clinical practice, yet the idea of a nurse as an independent decision maker was really new and foreign to them and was not cultivated. Thankfully, with the tradition at the University of Turin across all faculties, I know that you have an incredible history of inviting scholars and input from all over the world, which is evidenced by your renowned Neurological Institute, your incredible Art Institute with the Egyptian collection in Torino representing the second largest in the world because of Turin's ability and proclivity for reaching out and inviting people in. I was invited in, and what was initially going to be a short sojourn ended up being 4.5 years. So the physicians and the pediatric director at that time, who had spent time in the United States, and that is Professor Luca Cordero di Montezemolo and the late Professor Enrico Madon, really wanted to adopt the American way as they saw how much nurses contributed to the team in the United States. So they wanted to change the nursing model at Regina Margherita from one of being task-oriented, and at that time we implemented a model of nursing care called primary care nursing. In this way, over the course of 4 more years, we actually changed and revolutionized the way nursing was practiced at Regina Margherita, with the nurse at the bedside delivering care more autonomously and being more of a contributor on the healthcare team. So that was pretty revolutionary and the result of a very concerted effort by nurses and administration and physicians working together. The answer is it's a win-win on for everyone. Both students and faculty win on this count. And I really want to echo the words of our Vice Dean, Dr. Judy Honig, who describes the profession of nursing as the congruence of science and art. That is the synergism that results when we practice both the interpersonal art of nursing and the science of nursing. And this is very much related to the fact that nursing is a hybrid profession. It requires a cross-section of disciplines, including the basic sciences, advocacy, medicine, psychology, engineering, ministry, teaching, and caring. The global experience at the University of Turin profoundly deepens our students' skill set as they take in the science that is the basis for practice in Italy, but at the same time, they learn the ability to connect and develop relationships with many and diverse individuals, patients, families, and other professionals. My experience 30 years ago and the human connections that I made have enhanced my life and changed me in unprecedented ways, like no other experience has. And I've had 30 years to reflect on this. Our students, I believe, are changed in very much the same way. And I think that in addition to skill set and knowledge, we all become better nurses, better teachers, and better human beings. And with that, I want to thank you and emphasize how much I feel it's a privilege for me to continue working with you, for us to have our students there with you, and for your students to be here with us. Thank you and have a wonderful day. And please come to the University of Torino. It's an excellent place for an education.